joined from India. So we have joined this evening for the inaugural function of International Emergency Medicine Training Program. I would like to invite Dr. Venugopal, Director and Lead Consultant, Emergency Medicine, and the Program Director for the welcome speech.
Hello, good evening. For us, it is a very auspicious day and an auspicious event because emergency medicine in India is traveling to another level. So, just we are looking back, Aster MIMS initiated in 2007 as the first international training program in Calicut in association with George Washington University. That is in 2007. And those time even Medical Council of India is not recognized this speciality. And subsequently in 2009, Medical Council of India recognized emergency medicine, and in 2014, National Board of Examination recognized or started emergency a 3-year DNP training program. Those time, Aster is one of the first centers in India who started this training program. And entire more than 14 years of the history, we saved several lives. We made several benchmarks. We made several achievable and commendable job in the field of emergency medicine, in the field of community emergency medicine, in the field of paramedic training, and also in the field of EMS development. And with this short intro about the Aster in emergency, I will come to my job to welcoming all the gathering here. First of all, I welcome our chairman, Dr. Palmashri, Dr. Azad Mopan. He is physically not here, but still he is joining online. And second, Dr. Azad is the instrumental to develop emergency medicine in Aster Group. And without Dr. Azad, we cannot think about this kind of program. All the development of emergency medicine in our group. It's not only in Calicut, entire group in the Aster Group. Second, I welcome Professor Parag Singhal. He is the Executive Director of British BTA, that is a BAPIO Training Academy, and also Chair of Indo-UK Training Program. He is also the founder course director. And he is so keen to develop and bring this program in Aster. And for the last 1 year, we have several deliberations. Now it has happened and is a reality. You are welcome, Parag. Paragji, welcome. Next, I welcome our CEO, Group CEO, Regional CEO, Farhan Yazin. And I am sure like the last 1 year we are thinking, working, mailing and replying, but it is not happened in India. But it is happened in Aster MIMS only because of Farhan. It's dynamic, proactive and sharp intervention. That is the reason why this launching is happening now. Welcome Farhanji. Next, I welcome Professor Tamarish Kole. Tamarish Kole is my friend of mine. We worked for the last more than 14 years in the field of emergency medicine, and he was instrumental in many of the both international training program, national training program, so many. So without Tamarish Kole, we cannot move forward this kind of program. Welcome Tamarish. Welcome Tammy. We will lovely call him Tammy. Tammy, welcome. I welcome Professor Bibin Batra. He's the most dynamic and a quality-oriented man, and he is the former Executive Director of National Board of Examination. Very sharp and shrewd administrator and very quality-oriented man. I don't say nothing more about him. Welcome, Professor Bibin, to this function. Next, I welcome our CMS, Chief of Medical Services, Dr. Abraham Maman. He is a senior consultant and HOD of pediatric surgery and also head of quality assurance in the department. Welcome, Maman sir, to this program. Next, I welcome our whole-time director and senior consultant and general medicine, Dr. P.M. Hamza. Without Hamza sir, no academic program will happen in this institute. Welcome, Hamza sir. Next, I would welcome my friend, my colleague, my classmate. More than that, he is Dr. Ramesh Bazi. He is senior consultant, head of department rheumatology. More than that, he is director of medical education and academies, and also director of DNP program in Asher Mims of Calicut. Welcome, Ramesh. I welcome Dr. Naufal Bashir. Naufal Bashir is our deputy CMS and consultant neurosurgeon. Welcome, Naufal. My colleagues, my second in the department, Dr. Vineet C. Chandran is with me. Dr. Vineet, welcome to this program. Dr. Vineet Yen is coordinating this FRCOM program for our institute. Welcome, Vineet. Entire department academics is coordinated by Dr. Jalil. Welcome Jalil to this program. We have Pravida is here. She is comparing. She is also our operation head. Welcome, Pravida. I welcome all. Yes, we have the Pallavi Chawla is. She is coordinating all the India affairs. Welcome, welcome, Ji. Yes. I'm stopping my job. Everyone is waiting to see the rest of the thing. Thank you. Thank you so much.
Thank you, sir. Now I'd like to invite Professor Parag Singhal, the Executive Director BTA and the Chair for Indo-UK programs, to give us a brief on FRCOM and MBA program.
And it is one of the most influential organizations in the UK, working with Department of Health, NHS England, health education, and other regulatory agencies to promote excellence and both clinically and professionally. But we have set up a formal body, which is arm-length body of BAPU, which is called BAPU Training Academy, to promote that professional and clinical excellence. And that is where all the courses are being developed under the umbrella of BAPU Training Academy. As far as FRCAM program is concerned, just to give you some historical background, my relationship with Tamurish and Bipin goes back 10, 12 years, and we have been talking about developing a program, which is a seamless program between India and UK. And it was always Tamurish's vision that trainees do some training in India and then come to UK, because two are aligned and most of the trainees end up doing Royal College exam. So it was quite natural for us to think about whether they can get some clinical exposure in the UK in a streamlined, structured, supervised way, rather than trainees just coming at random and being used as extra pair of hands in United Kingdom, which happens to most of the overseas doctors. So with that in mind, we started discussing and we started this journey of exploring and trying to come up with a solution. And we met with many failures, but eventually we managed to find a model which actually was agreeable or liked by the regulatory authorities in the United Kingdom as well as Indian partners. So we are trying to involve in our journey institutions in India, universities in India, but more importantly, we are trying to create a consortium of universities in UK along with the regulatory bodies. Now, this program, as we go along, we'll talk more about it. But we first started with our medicine program, and our USP is 2+2. In emergency medicine, we are calling it 2+3, but generally it is 2+2. So 2 years training in India for any program we develop for MBBS doctors. Once they achieve a set of competencies and part 1 exam of the college, they will come to UK for further 2 to 3 years of training. In the case of emergency medicine, it will be 3 years, because Tamarish was very keen that to clear MRChem and FRChem, it's difficult. Therefore, we need to give longer time. So therefore, 5 years training we have instituted for emergency medicine. Now, we wanted these doctors not just to become good clinicians, but we also want these doctors to become leaders, because it is important that they start understanding the health challenges everybody faces. Therefore, with the help of University of South Wales, we have created a bespoke MBA program at a heavily discounted price. So our aim is that all these candidates, irrespective of their specialty, when they finish their 2 years or 3 years in UK, they are complete with either MRCP plus MBA or MRChem or FRChem plus MBA. And some of them will inevitably choose to stay on in the country, but some of them will come back to India. But when they do come back to India, and as Dr. Venu was saying, that emergency medicine is a phase of evolution, and these trainees and leaders will come back and help fly the flag of emergency medicine and promote this whole idea of initial resuscitation and training in India, which is currently missing or is happening in patches. The good news which came around was that GMC, General Medical Council, gave recognition to BAPIO for these programs. So BAPIO Training Academy has become official sponsors for these candidates for GMC registration, thereby bypassing or avoiding the need to do PLAB, which makes it very easy for us to create a program. And now that we are 1 year into the program with medicine and 6 months into emergency medicine, suddenly we are finding a lot of traction within India, and more hospitals are trying to associate with this journey. But more importantly, we are trying to get a lot of traction from UK institutions who want to join this and get trained doctors from India as part of the rotation, rather than as piecemeal approach. So it's a journey which is now coming to fruition. Our thinking and our vision is coming to fruition, and with the help of Aster, we believe Aster as a great institutional hub, not only for medicine, and I know about IMT training at Aster, but this emergency medicine, Aster is a leader in India to provide those services and training. And it is indeed a great honor and privilege. And on behalf of BAPIO Training Academy and BAPIO, I thank Tamarish Bipin, but more importantly, Dr. Venu and team of Aster to have agreed to be associated with us. So once again, thank you very much.
Thank you, Professor Parra. Now moving on to the official inauguration of the function. We have with us Chairman and Managing Director, Padma Shri Dr. Azad Mupin, giving us a video clipping of inaugural address.
I am extremely happy to welcome the International Emergency Medicine Training Program, which is a very, very unique course according to me. This 2+3 years course, which is being planned, has got its 2 years training in India and then 3 years in UK. This is done in association with the Aster MIMS Calicut, along with the other Aster hospitals in the region, as well as in UK, the University of South Wales, as well as most importantly, BAPIO. I really appreciate BAPIO for taking this initiative, which is going to help large number of young graduates from India and other countries to come into UK, get trained and come back. Not only with an FRCEM, the Fellow of Royal College of Emergency Medicine, but also with an MBA, which is a fantastic thing, because just learning medicine and emergency medicine in itself is great, but along with that, if they are getting a Master of Business Administration degree, that will add on to their armamentarium when they are looking at the future. I congratulate once again the AstraMIMS as well as the BAPIO and the University of South Wales for starting this program under the BAPIO Training Academy, and wish all the best for the organizations as well as, most importantly, the graduates who are going to be benefited by this. Thank you.
Moving on to the felicitation, I would like to invite Professor Tamarish Kohli, founder and course director, to share a few words.
And I know Aster for long years. In fact, if you look at the wall in my room, it has the picture of Dr. Mupen and Venu in the first convocation, which was held in 2008 at AstraMIMS Calicut for the first Indo-US program. So I've got very fond memories of Aster and great work experience to work with Venu and the team. What is unique about Aster is the environment and the ingredient which they have for emergency medicine. Emergency medicine is not just training within the department. It requires a high level of experience in pre-hospital care at the community level, voluntary work, and that makes an emergency physician a true emergency physician. And Aster has got all that ingredients in place for a trainee to experience the department care, as well as it has got a very strong, robust EMS service. It has got Angels, the award-winning community EMS service in Asia. So Aster Calicut is one of the perfect place and one of the most coveted training center of emergency medicine in India. So this program is perfectly placed in Aster. And I strongly believe that the trainees which will come out of Aster and move to NHS in UK will be one of the best as far as the standards of both the countries are concerned. Once again, I wish Venu and his team all the very best and look forward to recruitment and commission of the program. Thank you, Venu and the team.
Thank you, sir. Now I would like to invite Professor Bipin Batra, former Executive Director, National Board of Examination, to share a few words.
Good evening, friends. Thank you, Madam, for the very kind introduction. Friends, with the introduction of this program, we move on to the fourth generation of reforms in emergency medicine. I'll just touch upon what has been the history and various milestones. Many of us present in this group today who have witnessed how emergency medicine has evolved in the country. In the first generation of emergency medicine, the structured emergency medicine programs were continuing to evolve. The second generation was led by some overseas universities and the rapid growth of the membership of Society for Emergency Medicine and Society for Emergency Medicine, founding international partnerships with the global organizations and bringing the examinations to India, the MRCM examinations to India. The next generation, or the third generation of reforms, were when we launched the DNB emergency medicine program and bringing a large number of corporate, trust and voluntary not-for-profit hospitals into the mainstream teaching fold of emergency medicine. It took us almost a journey of 3.5 years to convince the government and the national board to launch the program and to have a formal recognition from the government of India for the program. And I'm very proud to state that Professor Venu and Tamarish were my partners in doing that lobbying and doing the standard setting with a large number of faculty members and well-wishers drawn from other organizations, including medical colleges. And that led to the third generation of reforms in emergency medicine. Now, very proud to state that the fourth generation of reforms in emergency medicine will be led by BTA. And all of us are here present today. This program is our third program. This will be our third commissioned site in a span of less than 12 months. We made a humble beginning with a batch of 4 seats a few months ago, and subsequently we had another batch of 8 seats at Sri Aurobindo Institute in Central India. And today we have the flagship hospital of the Aster Group joining herein. And it's not difficult to say or assess the beauty of working with Aster Group. Aster Group has always been quality conscious. It is omnipresent on both sides of the Arabian Sea. It is as strong in the Indian subcontinent as it is in the Gulf countries. So it's a natural ally. And I hope that this candle which is being lighted today of the fourth generation of the program, or the fourth generation of reforms, I would call it, in the city of Calicut, will further enlighten to various other institutions under the Aster Group and other institutions in the region. And hopefully we shall emerge as one of the better organized and better deliverables, a program which guarantees better deliverables in the days to come. Thank you very much, friends.
Thank you, Professor Batra. Now I would like to invite Dr. Abraham Maman, CMS, Director Quality and Senior Consultant in Pediatric Surgery, share a few thoughts.
Good evening, everybody. Padma Shri Dr. Azad Moopen, dignitaries offline and online, both from UK and in India. I bring you greetings from Aster MIMS. It is indeed a proud moment for Aster MIMS to be associated with BAPIO and BTA in this wonderful academic process which is being initiated today. Dr. Venu's passion has gone a long way, and we are very, very aware of how the work that he and his team has done over the last few years and the extreme success that they have brought. This is another milestone in their career and in their professional growth, and I wish both Aster MIMS and Emergency Department under Dr. Venu all the best in this future endeavor. I'd like to conclude by saying we at Aster MIMS reinforce our mission vision statement. We will treat you well, and we will extend this to BAPIO and BTA in their future endeavors. Thank you very much. Merry Christmas and a Happy New Year.
Thank you, Dr. Maman. Now I'd like to invite Dr. P.M. Hamza, the whole-time director and the Senior Consultant in General Medicine, share a few thoughts.
A very good evening to all of you. Professor Singhal, Dr. Azad Moopen, Professor Tamarish, who is very well known to all of us here in Aster. He has been associated with our emergency and the critical care unit from the very beginning. And of course, it is natural that the brunt of this or the pleasure, the privilege of this course has fallen on Venu very rightly. He has been, I would call him the master and the doyen of emergency medicine in India. He is the first to establish a proper emergency unit anywhere in Kerala and probably in India. And I'm sure he has had an association with various universities in US as well as now in UK. And it's my proud pleasure to congratulate him on this new course 2+3, as well as wish him all the best for the future. I'm sure his candidates will turn up excellent. And I wish to conclude by wishing you everyone a very happy Christmas and New Year. Jai Hind, good evening.
Thank you, sir. Now I'd like to invite Dr. Ramesh Basi, Senior Consultant Head and Department of Rheumatology, Director of Medical Education and Academics, Director of DNB Program, Astomems Calicut, to share a few thoughts.
Respected dignitaries, online and offline. It's a pleasure and privilege to be part of this great initiative of International Emergency Medicine Training Program by BAPIO and Astomems. This is a great opportunity to be trained in emergency medicine in India and UK and to gain globally recognized qualifications through membership fellowship of Royal College of Emergency Medicine and also to get an MBA in healthcare from University of South Wales. I congratulate Astomems management, especially Dr. Venu and Mr. Farhan Yasin, for coming up with this unique program which will ensure not only quality training in emergency medicine but also professional management of healthcare institutions. I am sure that this will soon be one of the most sought after program among the new graduates. I wish the program all the very best. Thank you.
Thank you, sir. Moving on to the end of the program, now I'd like to invite Dr. Naufal Bashir, Deputy CMS and Senior Consultant Neurosurgery, to deliver the vote of thanks.
A warm and graceful evening to all of you. It's my privilege to propose vote of thanks and also to acknowledge all those who have worked to make this program, the International Emergency Medicine Program, a reality. My sincere thanks to Padma Shri Azad Moopen, the chairman and chairman of our Aster group, who is a big visionary and who is leading us and giving directions all the time. Also thanking all the speakers, Professor Parag Singhal, Professor Tamarish Kole, Professor Bipin Batra, Dr. Abraham Aman, Dr. Hamza, Dr. Ramesh Basi, Dr. Venugopalan, Mr. Farhan Yasin, also the faculties of Aster MIMS Emergency Medicine team, and also I saw Dr. Shailesh Shetty from Bangalore who joined online, and all those who joined online. Thank you all. Merry Christmas and Happy New Year to all of you.
Once again, thank you and my best wishes to Emergency Medicine Department. Wishing a Merry Christmas and Happy New Year. Thank you all.
Likewise. Thank you.
Thank you.
Right. Thank you all.